Today's Tuesday. I'm losing track of my days. My husband says that's a good thing. But I'm on here today to talk about how to strengthen funding, participation, sustainability of your health programs and initiatives. A lot of the work that I do is really supporting health organizations and businesses with a health focused program, service, or initiative to be more sustainable, to increase participation from the community in their programs and initiatives and their events so that they can serve the people in the way that they have aimed to achieve or part of their mission and their goals. And also, there can be an improvement of health outcomes and access to resources. So, my name is Brittany Jenkins. I am the founder and CEO at Jenkins Public Health Consulting. We support health focused organizations and businesses, kind of just what I already said, and strengthening their programs and partnerships and trust with community, right? If trust between communities isn't there or strengthened and continuously engaged, we can't expect people to show up for these resources, no matter if they're free or they cost, right? And a lot of people in the industry talk about building trust, but like even though that is a common word or a common statement that's being said, we need to continuously seek opportunities to build trust with communities with every aspect of the work that we do. Whether you're doing work online or doing work in person on the ground. No matter if you are a community based organization doing work at the grassroots level, an organization at the state level doing work across the state, supporting organizations who are going to drip down those resources and funding to the community level, and even at the federal level, and dripping down that work to the state and then to the community. Every level and every aspect of the work that we do should be building trust with community, right? Because community is not just people who live in certain neighborhoods. Community are also people who are part of different associations who are going to bring back those resources to their community, right? And so I want to talk about the three things that I see organizations not doing much of, which is causing them to not find many funding sources, which is causing them to not be able to reach the people that they aim to serve, which is causing them not to have high participation or even reach their goals in strengthening or improving health outcomes or access to resources. So you know one of the things is program design. How is your health program designed, right? And a lot of the times organizations who have health programs, whether it's for profit or nonprofit organizations, they are typically funded by a grant, right? And there are a lot of organizations who are not, whether it's for profit or nonprofit. There are a lot of organizations who have a program that is not always funded by a grant. But in most cases, if you have a program that is funded by a grant, you are required to submit your design or what your plans are for developing and implementing that program, right? But there are still gaps. From what I've been seeing doing this work for decades, there are still gaps that are leading organizations to not have the participation in those programs from the community that they aim to serve and the health outcomes that they were hoping to achieve, right? And so with the program design, development, and implementation, there are some key things that you want to make sure are in place to strengthen the outcome of your program. Not just when you're implementing, not just when you're designing, but the middle, when you're trying to have a retention rate, a good retention rate, right? Also known as attrition. When people are coming in, we're super excited, from the community level, this individual is super excited to be a part of your program. But how do we keep them excited through the program period? And how do we keep them making sure that they get access to the resource throughout the program, right? How are we gauging that they're learning? How are we gauging that they're having an improvement of health outcome? And then how are we engaging long term after they have utilized that resource, right? Now, it might not even be a program. It might be an event that you're doing with your health organization. But there needs to be priority areas to make sure that you're capturing the outcomes throughout the time frame of which you're serving this person. Okay? So strengthening program design means something like creating more surveys to address what they are learning or if they're having any barriers. Because a lot of the times, again, in the work that I've been doing for decades, I'm seeing organizations put together these amazing programs that do get funded at least one time because if it's funded one time, it can be funded again, right? It's just strengthening your program design and implementation and your reporting, right? How are you quantifying the impact that you've made? But surveys is like any person coming in your program, they should do an initial survey. I like to say a needs assessment to really understand who they are, why they chose this program, and what their needs are. And that also helps to make sure that you're still aligning your program to their specific needs. That makes sure that you're doing individualized support, even if it is an on demand program or a grassroots level community based program. Needs assessments need to happen no matter if it is a full blown pilot program or a program that's being implemented for years. Those are the things that are going to keep you funded. Those are the things that are also going to help you reach more people because you're going to see commonalities in those trends from the surveys that you've collected the first, like upfront, really before they start the program, right? So collecting surveys at the beginning, in the middle, and at the end. So needs assessment, midpoint survey, post assessment, right? Some of the programs that I have with my company, I actually collect more than 3 surveys. I think for one of my clients, we have them collecting at least like 16 surveys over, a 10-week period. And I know that sounds like a lot. Some of them are optional, but when we're helping people to learn more about their health and to improve their health literacy, to make sure that they got access to the resource that we're trying to get them access to improve their overall health, then we need to make sure that that's happening, right? And if we're not collecting surveys, how do we know that that's happening? Because some people, everyone's different, right? I'm very outspoken. I'm an extrovert. I don't mind telling you that I need something, right? But everyone isn't that. So that survey is that secondary communication tool to make sure that we're meeting their needs, right? So looking at the survey, also with program design, I love to talk about this model, and everyone's like, "Oh, that's the easiest model," but literally, my company has been around since 2018, literally serving organizations across the country, the United States, and no one is using this model in the way that I believe it should be used to strengthen their program, to get more funding opportunities, to be more sustainable, and to reach the people that they aim to serve. And that's why we have our community impact intensive. It's an online course program with live components for health organizations, the staff of health organizations and leaderships, to really get those 3 things in order so that you can stay funded, whether it's government funds or other funds, non-government funds, because government funds aren't the only way to stay sustainable, guys. I've been a grant writer for 15 years. Grant fundings, federal funds, are not the only way to stay funded. And I think people are just so used to that being the common communication or conversation piece about grants. But federal funds are not the only way to be funded. Let's talk about that, right? But before I get into that, because that's honestly a whole nother conversation, and I can create a YouTube video on that. But the health belief model, the health belief model, and I am sitting outside the library waiting for a networking event, so I thought I'd go live. The health belief model. And if you are a health organization, drop it in the comments if you are a staff or leadership of health organizations or a business, right? You're working for a nonprofit or a for-profit organization, you're staff of a health organization. Let me know in the comments. Sorry, guys. I'm not even reading the comments. Hi, Ray from New York City. I'm from Indianapolis, Indiana, but I actually live in Birmingham, Alabama. But yes, the health belief model is one of those key models that I believe really helps organizations structure stronger programs, position them for more funding opportunities, and to reach more people that they're aiming to serve. Right? My background is chronic disease prevention. 60% of U.S. Adults have at least one chronic disease, knowingly or unknowingly, and that number goes. I think 40% has 2 or more chronic diseases. So chronic disease is always going to be my passion, prevention and also self-management of chronic diseases such as diabetes, right? But the health belief model is something that needs to be in every aspect of our program design, our marketing, and when we're doing community outreach and engagement events for our community. If you're not using the health belief model, you need to go look at that, understand what it is, because it's very simple. And I'm going to tell you what those 6 parts of the health belief model is, and go make small tweaks to your program. And I can almost guarantee you, when you make those small tweaks, you will see an improvement of interest from funders or the community, from interest from potential strategic partners and community partners, because it will clarify things and why your program is needed. So the health belief model has 6 pieces to it that is easy to strengthen your programs, that will help you create better community outreach and engagement events, right? And community outreach and community engagement are 2 different things, but this is beneficial for both of that, right? So the health belief model is all about, the first step is perceive susceptibility. And I don't believe it goes in any specific step, but these are critical elements to include in your program design, in your communications, in your marketing, when you're having conversations with people about their health. Because some people, health literacy, 9 out of 10 adults are not health literate. So we need to be using this model. It could be so basic to people, but look, the most common knowledge, basic things, people are not paying attention to. And that's why we make life harder than it is, because we think things have to be so much more complicated than it is. Okay. So the first thing is perceive susceptibility, right? How how do they perceive themselves to be susceptible to getting diabetes, right? I am huge on, I used to be an environmental health specialist in my background when I first started working in public health. And that changed my life forever. As an environmental health specialist, I first was a pool inspector, which was pretty awesome. Have a lot of stories about that. But with being an environmental health specialist, I also did food inspections of grocery stores, gas stations, convenience stores, all types of restaurants, even Toys R Us. We actually inspected them because they had baby food and formula. So any place that has formula, you will be inspected by the health department. And, so many awesome, unique stories. But the thing about that is understanding the food quality, where our food is sourced from, all the things. So perceived susceptibility is like you're eating at Chick-fil-A because Chick-fil-A has a great customer service experience, right? But are you really understanding what's in the food, right? Because they've branded themselves in a way to say, our food, you get quality experience, but they're not talking about the quality of their product, right? And, some of Chick-fil-A's, most selling items have over 50 chemicals in one item that are actually leading to chronic diseases, diabetes, cardiovascular disease, etc. This is public knowledge. Okay, go look it up. Even though I was eating, Chick-fil-A, I am not perfect. And now that I know, I'm going to do better, right? Because that should not even be the case. That shouldn't even be in our food. So understanding perceived susceptibility and using that in your marketing, communications, your conversations, how to strengthen the design of your programs are going to help people understand that they are actually susceptible to the thing that you're teaching them, right? It's not about fear. It's about education. It's about literacy. It's about self-empowerment. It's about long-term health, right? I'm a young mom. I'm going to say it. I'm a young mom. Yes. But I'm not really a young mom. I'm in my 30s. But I like to say that because I feel good. But I also want to live long to see my daughter grow up and, me and my husband walk her down the aisle and live a long life for her and be a part of everything, right? So what I do now impacts my health for later. So what is that perceived susceptibility? Right now, you might not think something is going to impact you right now, but over time, it will if we don't change our habits, if we don't change our environment, if we don't change our mindset. Because maybe you're this health nut who, is doing all the great things, but you have a poor mindset. You have self-doubt that is stopping you from your biggest opportunity in life. So what does the susceptibility look like? That's the first part. Okay, I could talk all day about this. Perceived severity. How severe is this issue in your life, right? And it could be maybe you ate at Chick-fil-A one time, right? That's going to be my example. So the perceived susceptibility might not be very high, right? But if you eat at Chick-fil-A a couple days a week, you're eating there for breakfast or lunch or snacks or whatever, then you might understand that this is pretty severe and you should make a lifestyle change, right? And start making your little chicken sandwiches at home and learn how to make the recipe from scratch, whatever, right? So perceived susceptibility is how severe is this thing in their life and how quickly do they need to make that change. Perceived benefits, right? What are the benefits of making this lifestyle change as this common example I'm saying, or making a lifestyle change or utilizing this new tool, or what is the benefits of learning this new piece of knowledge? What are the benefits of having a mindset shift so that I can step into my greatest self, right? So perceived benefits. Now, perceived barriers. What do they think their barriers are? To not doing that thing, to not changing their lifestyle, to not accessing that certain resource. What is the perceived barriers? We need to be addressing that in our program design, our marketing, our communications, our outreach, our engagement with community, right? At every level of government, federal, state, and community-based level, right? Also, I can't even read my handwriting. Self-efficacy, self-efficacy, right? How confident and how motivated are they in doing that thing to changing their lifestyle overall or improving their lifestyle overall, right? Some people don't need to really change much, but there's modifications that we can do to improve our overall lifestyle in the short term and in the long term, right? So that's the health belief model. I think there's one other step in there. I don't know them all by heart, but these are key components of strengthening your program design to identify new strategic partnerships or bring them in, right? So that they can say, hey, like, I think this is a great opportunity to support you. And now that I understand exactly what you guys are trying to do, I'm happy to invest my time, money, my building so you can hold our community events and meetings at whatever that looks like, okay? So that's the first thing. Strengthening your program design. Our community impact intensive for staff and leadership of health organizations is opening up soon. And I want you to be a part of that, okay? I really do, because organizations every day are saying the number one headache is funding. And I think that's always going to be a thing, because even if you're not a part of an organization, in your personal life, you want more money, right? You want more stability. You want something that's consistent income that is beyond the needs that you have. That's life, right? So people will always say that funding is the main issue. But at the same time, how can we strengthen our current efforts to attract more opportunities and funding to you, right? And funding can be in kind, funding can be, direct funds to your organization. There's so many ways to strengthen funding opportunities or to alleviate cost of certain things. So that's a part of the conversation in the training that we go in depth into inside the intensive. Okay, automation. The second thing is automation, guys. You know, a lot of the organizations that I'm working with, a lot of the organizations that I'm networking with on a regular basis, I'm just kind of surprised. Like, I'm not saying that, it's 2025, you should have already known this, but like, automation is not the same thing as AI. AI can be complex, especially in the healthcare and public health sector where confidentiality and HIPAA is an issue, and you can't just be using automation and not automation, but you can't just use AI as much as you would like, because you have to be careful and use it appropriately. However, automation is time saving, money saving. Let me put my phone on do not disturb. Hold on. Automation is time saving, money saving techniques for health organizations at any level, any budget, free tools out there to help you do that thing. Automation can deliver your free resource to your community while also tracking the outcomes or how many downloads. That's automation versus, I was working for a statewide center. I was working for a statewide poison center. We were counting pieces of paper by hand versus working with a print company who actually printed the materials and having them, bind them so that we didn't have to count out 50 stacks every time we wanted to go to an event, right? That's a little piece of automation. That's more so efficiency, but also when they're downloading stuff from our website or when we're, doing some of the part of our work, what tools or, software can we use to automate what we're trying to do, right? So automating your digital resources, automating your signups for your outreach events. A lot of times people are still doing this manually. They have their outreach event promoted online or right there at the stoplight. But then you say, you know, go to our website. You go to the website, you just see the day and time. It's like, okay, that is an opportunity for you to put a sign up link or a QR code, and they fill out their information, and now you have exactly who you are expecting to attend that outreach event. But you don't stop there. You don't just collect their name and email or just, their name and email and stop there and say, I'll see you at the event. That's a way for you to begin that communication and relationship building with them, right? That's called an email marketing sequence. That's automation. Once that person scans that QR code or goes to your website and says, I'm interested in your outreach event or I'm interested in your community presentation, that's the time to say, thank you, Brittany. We're so excited that you signed up for our community event. We can't wait to see you. In the meantime, you should learn more about what we're trying to do and, respond to this survey. There's so many ways to create an email sequence that keeps people engaged, knowledgeable, and also requests donations in a sincere way, right? Sometimes organizations are requesting donations and like, hey, we're looking to raise $10,000. Help us. I will likely never help them because they're not telling me why. They're not telling me how the money's going to be used. And funding trends have went up and down, but especially with millennials, it has went down because we want to know what is being done with this money, what's the why, etc. So there's so many ways to use automation to your advantage. Automation also includes standard operating procedures on how you're going to set up your outreach events so that everyone can know exactly what's happening and what tools are needed or resources that you're taking without having to manually think through that every single time, right? Automation is also when you're at community outreach events and you're conversing with people, you're using that as a way to collect surveys, and then also put them in your email funnel and say, hey, we want to connect with you. Are you someone who might be interested in a diabetes self-management program? Boom. If they are, they can also respond back or they can fill out a form to say yes, they are. And then that can give them information about diabetes and that can help them sign up to an online program or an in-person program. Automation is the time saving, money saving thing that people need, staff and leadership need for their health organization. Okay? Strategic partners is my third point. Strategic partnerships, right? Without strategic partnerships, and I'm going to tell you that strategic partnerships is not just another nonprofit. Did you hear me? Strategic partnerships is not just another nonprofit organization with a similar interest or goals that your nonprofit or for-profit organization has. It goes way deeper than that. And even world-renowned companies that I've worked at and have helped as clients are missing this piece. And even if they have thousands of strategic partners, they're not engaged. They're not actually doing the thing that they said that they would help do. And so we have a 4 E's framework that really helps to re-engage and ignite excitement back in our strategic partners. So strategic partners goes beyond other nonprofits. It goes beyond that. It includes other businesses. So your strategic partners include for-profit, nonprofit organizations. It includes community champions, right? Maybe someone has already went through your program or have been communicating with your staff and leadership for a period of time, and they trust the work that you guys are doing. Those are our strategic partners who are going to tell their neighbors about what we're trying to do in their community so that they can build trust, so they can trust the work that we're trying to do. Okay? Strategic partners are also volunteers. Every single person who is supporting your organization and speaking on the behalf of the resources that you guys have available should be in alignment with the mission, should be in alignment with what you're offering and what you're trying to get our community to understand at the community level, state or federal level. Everyone should be clear on that statement or that need, right? And that's kind of like an elevator pitch. Everyone should be in alignment with that. Just because they're a volunteer, I don't think that they should just be standing at a table, oh, I'm just a volunteer. I'm not sure. No, that is improper training of your volunteers, and everyone should know exactly what's happening if they're going to fill in a position to support that organization. If they're a volunteer and they're supposed to be bringing in donations, they should know exactly why, at least 3 to 5 points on why they are bringing in donations. And I'm not saying they need to know that by heart. Give them the resources and tools they need so they can reference those things from their phone or printable, etc. Right? Coalitions are also your strategic partners. Coalitions. Are you a part of a coalition? Is your organization leading a coalition? What is that? How are we bringing in strategic partners to strengthen, expand, and support our efforts? Without doing so, you are trying to do things alone. And if you have strategic partners, how engaged are they? Right. I was just talking to an organization, been around since like the 1900s. Like, I don't even know. It was 19 something. I can't remember. And they was like, oh, yeah, we have dozens of strategic partners telling me all the great names. And I'm like, okay, I'm listening. Okay, so how many showed up at your last, meeting? Oh, I think it was about 10. 10 out of how many? 10 out of 1,000 people? I'm just giving out a random number. Okay, so you have 10% engagement. Less than 10% if it's 1,000. Um, okay, so how many people are actually donating or, putting money towards the initiatives? Oh, nobody currently. Okay, so like, what are the commitments of being a coalition member or, being a part? Like, anybody who's a part of a coalition or a board should be pulling their weight because this is a collaborative effort, and without doing so, we cannot achieve the goals or the mission or improve the health outcomes or improve access to resources as we aim to do. We can't do it alone. So organization, staff, and leadership who are trying to pull all of this weight, pull these boulders by themselves. We need everyone. We need all hands on deck. If you're going to be at the table, please be at the table using your unique skill and your unique ecosystem of connections to help pull this weight, right? And help us pull this mission along in our community at the state and federal level as well, right? Because not what you're doing at the community level isn't just for the community level. We're creating, things that can be replicated across the country. So don't think of it as just your community. See how this can be replicated to change lives throughout the country, throughout the world. Okay? So, strategic partners. Who's at the table and who's helping us with this capacity? Who's helping us strengthen our reach or expand our reach? We do have an amplify, excuse me, we do have a 90-minute masterclass called Amplify on how to expand the reach and engagement of your marketing and communications and also your community outreach. Okay, so expanding the reach and engagement of your marketing and community outreach is essential to reaching the people you aim to serve. It's also essential to identifying and attracting new strategic partners who are going to give you money, who's going to help you, let you rent out their space, or not even rent, but utilize their space to do community events and presentations, right? The list goes on to help you man your events, right? They can give you other staff or community health workers or certified health education specialists to help with screenings and to help with X, Y, and Z. So capacity building, that is capacity building, okay? So all of this really that I touched on, strengthening program design, automation, strategic partners will for sure improve funding opportunities, increase strategic partnerships that are engaged, and also improve health outcomes of communities by making sure we're reaching them in those different areas that I talked about today, reaching them more effectively without these generalized approaches, right? And I can go on about community outreach. I'll create another video about that. But it's super impactful. I love talking about this. But those three things are what organizations should be doing on a regular basis. Utilize the health belief model. That will help you tremendously. If you have any questions or you want to go in depth about this for your specific organization, because every organization is different, even if you are two health departments, even if you are two chronic disease prevention programs, everyone's different service area, different needs, different levels, different staff members, etc. Let's go in depth about your organization. Let's talk about what's happening, what's going really well, what you want to continue to happen, but then also let's talk about what's not happening and what you know is possible. And if you don't, also knowing more information of what's possible, right? We help organizations really see that there's so much greater possible. There's so many ways to save money the way that you're doing it right now. We can save you $30,000 per year. By looking at the way you're doing it, typically I can help an organization quantify the cost of saving $30,000 per year per staff member. Okay, and people are like, how do you do that in public health and healthcare? I'll show you how. So there are some free resources you can download. Our what is it? Community Outreach Guide. That is a free downloadable guide that gives you 6 easy ways to instantly improve your community outreach and engagement. It also includes some automation tools, some fun tools to keep people engaged, to collect information, and so forth. So check that out, our community outreach guide. And then we also have our guide on achieving health equity, which is a really good guide. It talks through health equity. It even includes some AI prompts for you to evaluate your current efforts. so that you can actually strengthen relationships, strengthen access to resources for everyone. You know, marginalized community, underserved communities, it's not just about black people, it's not just about minorities, it's about everybody, you know? So, you know, this whole thing that's happening with legislation is wild. But at the end of the day, equity is for everyone. It's not just for race. And we know there are people who are disproportionately affected, right? More people of a certain race and gender are affected compared to others. That's, you know, disparities. But equity is for everyone. Everyone deserves access to a vehicle. Everyone deserves access to food. Everyone deserves access to clean water and clean air. That's equity. And we need to make those small changes to make sure that that person who needs, you know, a different type of faucet to drink from can actually drink from that faucet so that they can get clean, clear water to improve or maintain good health, right? No one should be drinking, you know, water with poison in it. Like that's not right. That's not equity and that's not fair. We all deserve that. So that's equity. That guide on how to advance health equity is available to you for free. And if you can't get access to that, please let me know and I'll send it over to you. You guys have a great day. I'm about to go network and help make a change in my community and help improve access to resources for people in my community. And again, these things are going to be replicated all over the United States because that's what I'm passionate about. So thank you for tuning in. This is Brittany Jenkins, founder and CEO at Jenkins Public Health Consulting. Stay tuned for more information about our community impact intensive that is opening up soon for staff and leadership of health organizations. Have a great day.